Hi, my name is Varun Goyal, and I'll be speaking about tobacco prevention policy. Tobacco has remained one of the leading causes of preventable death and disease in the United States. Based on data from the 2021 National Health Interview Survey, an estimated 46 million US adults, or approximately 18.7% of the population, reported using a tobacco product. 11.5% of adults were found to smoke cigarettes, 4.5% of adults were found to smoke e-cigarettes, 3.5% of adults were found to smoke cigars, 2.1% of adults were found to use smokeless tobacco, and 0.9% of adults were found to use pipes. Among people who use tobacco products, 77.5% reported using smoking products, and 18.1% reported using more than one type of tobacco product. The prevalence of tobacco use was found to be higher among men, people aged more than 65 years, people of non-Hispanic descent, other races, non-Hispanic whites, rural residents, low socioeconomic individuals, the LGBT community, Medicaid or uninsured individuals, individuals with a GED as their highest education, those with disabilities, and those with psychological distress. The Smoke Free Act is a state law in Illinois that protects residents, workers, and visitors from the harmful effects of secondhand smoke and vapor by prohibiting all forms of combustible tobacco in public spaces and places of employment since 2008. This ban includes forms of tobacco such as cigarettes, cigars, hookah, e-cigarettes, vapes, or any other electronic smoking device. This includes all indoor areas and outdoors within 15 feet of any entrance, exit, windows, or ventilation. All e-cigarettes were added to the Act on January 1st, 2024. The Family Smoking and Prevention and Tobacco Control Act, also known as the Tobacco Control Act, was a federal law that was signed on June 22, 2009, to give the FDA authority to regulate and manufacture, distribution, and marketing of tobacco products. The Tobacco Control Act restricts tobacco marketing and sales to youth. It specifically bans sales to minors, vending machine sales, and the sales of packages with less than 20 cigarettes. It also prevents tobacco brand sponsorships of sports and entertainment events or other cultural or social events, and all free giveaways of sample cigarettes and brand name non-tobacco promotional items. The Tobacco Control Act also requires that all smokeless tobacco products have larger and more visible warnings. Each package must have a label indicating that the product can cause mouth cancer, gum disease, tooth loss, and addiction, and that it is not a safe alternative to cigarettes. The Tobacco Control Act also prevents companies from making claims of reduced harm, such as light cigarettes, without filing an application for modified risk tobacco products and obtaining an order to market as such. The Tobacco Control Act also requires disclosure of ingredients in tobacco products and must provide the FDA with detailed information. It also preserves state, local, and tribal governments to regulate tobacco products in specific areas. This act also requires the tobacco company owners and operators to register annually and open their manufacturing and processing factories to inspection every other year. The Tobacco Control Act also allows the regulation of nicotine ingredients and levels of tobacco products and bans characterizing flavors. The primary form of control of the tobacco industry is the United States government. The three different branches of government have various roles that can be used to improve current policy for tobacco prevention. Legislation is key to effective tobacco control as it institutionalizes its commitment to control activity in a way that voluntary measures are unable to do so. The Smoke Free Illinois Act and the Family Smoking Prevention and Tobacco Control Act can be improved by introducing various measures such as increased taxes on tobacco products to make them more expensive and discourage spending, while simultaneously increasing funding for anti-tobacco measures. The federal government has not increased taxes on cigarettes and other tobacco products since 2009. It is one of the most important actions to reduce smoking initiation in youth and incentivize quitting. The legislative branch could also increase the regulatory power of the FDA for additional powers to ban sales of certain retail tobacco products. It could also improve these acts by increasing federal investments in tobacco prevention and cessation and strengthening the restrictions on the manufacture, sale, and marketing of tobacco products. Similarly, these policy changes can be put into place by the executive branch through a presidential executive order. Presidential executive orders have the force of law unless they are overturned by Congress or future presidents. These orders have improved public health in the past, such as the formation of the Environmental Protection Agency in 1970 by Richard Nixon. The president will have to cite the underlying legal authority and is usually upheld by the judicial branch. Lastly, the policy can be used to make the judicial branch hold tobacco companies liable for various transgressions of these laws and hold them accountable. Unfortunately, tobacco lobbying at all branches of government has made this difficult. I believe that the best approach to improving tobacco law is through the executive branch at the federal level. Executive orders avoid the lengthy and difficult process of going through the legislative process and working against the tobacco industry lobbying. As long as the executive orders can focus on a single improvement at a time, it'd be useful for reducing resistance towards change.